Good morning and welcome to the Health and Social Services Committee meeting for October 3rd. Can I have a roll call?
Waiting for Councillor Anderson, please.
Perfect, and thank you. Is there any declarations of pecuniary interest in any of the agenda items? Hearing none, I'm going to move over to the adoption of the minutes from September 5th. Can I have a mover? Mayor Foster, Chair Henry. Any questions? Seeing none, we have no statutory public meetings. We have 2 presentations, and I'm going to call on 5.1, which is Krista Leader. She's the Manager of Population Health Division, and Rebecca Mills, Manager of Population Health Division. Come forward, please.
Through you, Madam Chair. Can you hear me? Yeah? No? Okay. How's that? Better? Okay. Through you, Madam Chair, thank you for the opportunity to speak today about public health's home visiting programs. My clicker's not working. Oh, there we go. These programs are designed to promote healthy parenting relationships, and optimal growth and development of children in such a way that helps Durham's youngest citizens reach their fullest potential. Rebecca and I are excited to talk to you today about Healthy Babies, Healthy Children and the Infant and Child Development Program. Healthy Babies, Healthy Children is a free and voluntary home visiting program offered to families who have identified at risk for parenting success and supporting their child's growth and development. Families are supported by a public health nurse and family home visitor who work together to strengthen parent capacity by providing support with parent-child relationships, and making connections with their community through service coordination. At the HBHC program, they thrive to help children get a healthy start in life. And in this program, the parent is the client. The Infant and Child Development Program is also a free and voluntary home visiting program that services children between the ages of birth to school entry. Consultants work with families who have concerns about their child's development or who have a child with a disability, medical concern, or developmental delay. Consultants provide routine-based developmental programming and intervention services. They offer resource information, and they support families with service coordination to community partners. In ICD, we believe that when children are provided with a positive and healthy early start, they have the opportunity for a bright future. And in this program, the child is the client.
Research tells us that identifying barriers as early as possible can improve the life chances of vulnerable children and their families, build family strengths, and support healthy child development. Our 2 home visiting programs are designed to work with families to address adversities and overcome barriers in such a way that can impact children's lifelong growth, health, well-being, and development. With the continued increase in Durham's population, these home visiting programs have also seen an increase for the need for resourcing and modeling to support healthy parenting and early childhood development screening and support and community connections. As such, Healthy Babies, Healthy Children and Infant Child Development work collaboratively with community partners to identify trends and challenges to ensure our services are responding to and meeting the needs of families. In addition to our work with families and children, we have a paramount role in securing and sustaining relationships with our community partners to promote awareness and service coordination efforts. As noted on this slide, you can see some examples of our current partnerships. These partnerships allow us to be active in community events such as the Ready, Set, Grow events, welcome center initiatives, and local fairs to ensure families are aware of our programs and have access to services that will meet their needs. These partnerships also allow us to support families with warm transfers to services as needed for their long-term parenting journey long after the child has aged out of our programs. Additionally, we are dedicated to supporting families with advocating for equitable access to services and community inclusion. Our team seeks out and implements training dedicated to diversity, equity, and inclusion, and our programs have a presence at internal and external working group tables as a way to promote and support ongoing inclusion. This is evident in our staff's representation on Durham Region's DEI committees and connections with local hospitals, healthcare providers, and community agencies such as the Welcome Center Immigration Services. The Healthy Babies, Healthy Children program is funded in part by the Government of Ontario, Ministry of Children, Community and Social Services, and the Region of Durham. For over 27 years, families have been connected to the Healthy Babies, Healthy Children program through our local hospital partners, healthcare providers, and recently by self-referral. The majority of our clients come through the hospital channel following birth. All Durham Region residents who are expecting a baby or parenting a young child that has not entered school are eligible for screening into the program. Those that screen with risk are offered an in-home assessment with a public health nurse. Some examples that put a family at risk are financial concerns, lack of social supports, mental health concerns, substance use misuse, perceived inability to parent, and family in need of newcomer support. If the assessment identifies a need for additional support, families are invited to enroll in the program. We currently have 300 active families participating in the program. This means that 300 families in Durham Region have been identified with risk and are benefiting from an in-home assessment by a public health nurse to benefit from targeted interventions, blended home visiting model supported by a public health nurse and family visitor who work collaboratively with families to support their tailored goals and personalize a family service plan. Support services to assist and make information accessible to the family in a variety of ways to be effective. Support with initiating community connections and service coordination, such as accessing other services like healthcare, mental health support, housing, childcare subsidy needs, and food insecurities. By investing in supports early in life and recognizing the importance of accessing positive social determinants of health, the HBHC program aims to enhance stability, safety, and security for our youngest citizens in their home and with their caregivers by providing opportunities to achieve their potential. Families who screen without risk or who are assessed to be low risk are offered resources, information, and referrals to other community programs. Since we receive most of our referrals from the hospital and healthcare providers, we estimate that for 2024, 4,200 families will be screened. Public health nurses and family visitors will conduct approximately 5,500 home visits, which will be supported by approximately 450 assessments. These assessments are designed to identify how well the parent and child are communicating and highlights areas for further development. The assessment is repeated throughout the course of service, which helps demonstrate improvements over time. As Durham Region population increases, we predict that the demand for our program will increase as we continue to identify and address the need to support children and families' determinants of health.
Funded in part by the Government Ministry of Children and Community Services and the Region of Durham, the ICD program has been offering children in the Durham region an early start to a bright future for over 40 years. The program offers intervention services to children living in Durham who are between the ages of birth to school entry and who have a developmental concern. Services are provided by an infant and child development consultant and/or an occupational therapist, and may include conducting assessments to help determine the needs of the child and the family, providing developmental programming through modeling and coaching, and providing strategies in a way that are embedded into the child's daily routine. Using a routine-based model of coaching and modeling has proven to enhance families' resiliency and improves relationships within the family unit, which in turn creates connections for sustainable parenting support. And lastly, the consultants collaborate with community partners to support service coordination and warrant transfers. For example, the ICD program has a robust transition to school process for children entering kindergarten for the first time, and we offer transition to support for children entering early learning and care. On average, ICD's annual estimated service reach is to service about 900 children who have a developmental concern. We service about 850 families with routine-based intervention, modeling, and coaching, and we conduct over 300 visits per month with a mighty team of 16 consultants. And as Rebecca mentioned, as Durham Region's population increases, we also predict an increase in demand of our program as we continue to identify and address the needs to support children who have a developmental concern in our region. And to conclude our presentation today, I wanted to share 2 quotes from families. One parent said, and I quote, "HBHC helped me in so many ways I cannot explain. They helped me be the best parent I can be," end quote. And another family expressed, quote, "Thank you for all the support ICD offered. It truly is improving the quality of life I can provide for my child at this time," end quote. And we'll open it up for questions.
Well, thank you to both of you for the presentation. Mayor Foster.
Madam Chair, thank you. You're taking me back many, many, many years. My first job out of university was working, you'll know, Surrey Play Center on their behavior management ward. I think I know what I think I know the answer to this. You speak of modeling studies, the interaction. Are you doing any longitudinal studies, gathering any data to look at net outcomes, what's positive? I see a grin happening there. So taking a look at what you're doing following the interventions versus non-interventions, are we using this to gather knowledge?
Through Madam Chair, I can answer that question with regards to the Infant and Child Development Program. We conduct surveys and feedback from families on a regular basis, but we also we create family service plans with families that identify their priorities with regards to service, and then we also track throughout service delivery. We identify if those strategies have been completed or met in some way with regards to the parent's perspective. So yes, we could pull some potential data about whether interventions were successful.
Okay, so I'll leave that thought with you. And just a closing comment, Madam Chair. As much as you look at the children, the interventions have a massive beneficial impact on family and extended family. So thank you. I don't know that we always recognize that. Madam Chair, thank you.
Thank you. Any further questions? Any questions online? Seeing none. Thank you so much for the presentation. I do have one question, and as we move forward with the uptake of the programs that are being offered, are you finding that the limitations of the lack of physicians, family doctors in the community is a big impact to these new families?
Thank you, through the chair. Yes, our programs both work very hard to support our clientele with accessing healthcare providers. We do have lots of conversations on how we can do that, and it is a challenge, but we do find strategies to support them and so that they can get those developmental checks and also other services that they need related to their healthcare needs. So thank you.
Okay, appreciate that. And again, thank you for the work you do, and very good start to a family as they move forward with the development of their children. It's a great program. Thank you. I'm now going to move on to 5.2, and Christine Wilmot, Manager of Employment Service System, Income, Employment, and Homelessness Support Division. Good morning, Christine.
Good morning. Thank you, Madam Chair and members of the Health and Social Services Committee for the opportunity to present today. I'm here to provide an update to you on the work that we have been doing as the Service System Manager of Employment Services in Durham Region. As you are aware, in 2019, the Government of Ontario announced the Employment Services Transformation. As part of the transformation, the new service delivery model would integrate social assistance employment services into Employment Ontario, which is funded by the Ministry of Labour, Immigration, Training and Skills Development. This new model would be administered by a service system manager known as an SSM. The purpose of this model was to enhance employment services, better addressing the needs of job seekers, businesses, and communities more effectively. Beginning in 2019, the competition to become an SSM was launched in a phased, rolled-out approach across the province, beginning with 3 prototype areas. Moving forward to 2023, after a multi-staged competitive bidding process, the Durham Region Employment Services Consortium was awarded as the Service System Manager for Durham. The consortium is led by the Regional Municipality of Durham and includes the Durham Workforce Authority and Durham College. The new integrated model was launched January 2024 following an extensive planning period. The planning period, which took place from May to December 2023, involved a mixed methods evaluation that included a comprehensive analysis of the following 3 categories. The first was document review. A network-wide system evaluation was completed using various data collection methods from the previous 4 years to assess the viability of the existing service delivery network. The second looked at quantitative data. We analyzed the data, determined benchmark statistics, and identified patterns, trends, and outliers. The analysis allowed us to look at the performance of individual service providers, as well as compare their data to the average of the network and the province. We were able to identify the strengths and areas for improvement of each service provider and measure their current performance against the new service delivery model. The next step of the evaluation was performing a qualitative analysis. We conducted surveys, service provider consultations, community consultations, a service provider questionnaire, and risk assessments. Worth noting, it was important to us to engage with community organizations serving those who are furthest from the labor market. All of these steps helped inform and drive the transformation of the system and assisted with the program design. During our consultations, we gathered valuable input and feedback on the development of the vision, mission, and core values of this SSM. Engaging with the community was a priority for us. Subsequently, the SSM refined the vision, mission, and core values to effectively guide the network in the delivery of the integrated employment services system. Another component developed early in the process of program design was the governance model. These committees are to assist with realizing our system values of accountability, transparency, and continuous improvement. This governance model aims to have participants collaborating to identify local priorities, maximize opportunities, and enhance effectiveness. As you can see here, we have 5 committees that are in development. The SSM is centered on an approach to service delivery that meets the needs of equity-deserving individuals who have been historically excluded from the labor market due to systemic barriers. Evidence-based measures were utilized by the SSM in order to identify organizational targets for each service provider that was equitable in distribution and reflective of community needs. Geographic information mapping exercises were used to gain information on the service providers' locations relative to priority demographic factors such as low income prevalence, priority health neighborhoods, and population density in Durham. The design of the new funding model resulted in increasing funding for 80% of the service providers in the network, marking this their first increase in over a decade. The funding formula ensures equity across the network. Funding for the network also consists of a performance-based framework and lends additional capacity to support individuals at high risk for long-term employment. With regards to assigning organizational targets, we utilized the information gathered from the needs assessment and collaborated with each of the existing 12 service providers to assign their organizational targets and key performance indicators. Through these methods, we aimed to provide additional capacity to serve clients while maintaining operational funding stability for the service provider network during the first 15 months of integrated employment service delivery. The existing complement of 12 employment service providers in Durham was fully retained during the transition process through successful service agreements contracted by the SSM. From the 12 service providers, we have 19 locations, including 5 itinerant sites, widely distributed throughout Durham. Through the transformation, we enhanced service accessibility by adding itinerant sites in Orono, Newcastle, and Cannington. Also noted on the map are the OW and ODSP office locations to exhibit the close proximity of services for clients. Our program designed focused on supporting individuals who are furthest from the labor market. The key performance indicators established by the ministry highlights several equity-deserving groups, including individuals with disabilities, ODSP recipients, Indigenous peoples, Black and racialized individuals, youth with higher support needs, and newcomers. As the SSM, we are implementing specialized supports for our service providers to assist with the unique needs of the clients. We have established a partnership with the Canadian Mental Health Association to build capacity within the system. CMHA provides 2 mental health employment support consultants who work collaboratively with the network through the delivery of mental health consultations, referral groups, group facilitation, and information sessions to help support clients with mental health concerns find and maintain competitive employment. In addition, the SSM will be hiring an Indigenous support worker to support the capacity of the network. This individual will provide culturally relevant training, support, and recommendations to service providers and support to Indigenous clients. Alongside the base operating funds, I'm switching slides here. Alongside the base operating funds, the SSM invited service providers to submit expressions of interest to receive specialized funds in order to deliver enhanced services to the previously mentioned inclusion groups. These initiatives were informed by community needs and identified gaps. Examples of enhanced services include computer literacy for newcomers, employment workshops for Indigenous clients, and youth pre-employment programs. Digital enhancements include the development of the Employment Services microsite, the creation of a SharePoint drive, the procurement of a case management system, and the purchase of career development tools. Network development has been a key focus for the SSM. Extensive staff training and development has been provided to the network in order to advance the capacity and improvements. And training will continue to be ongoing, an ongoing strategy. Collaboration is ongoing. The SSM engages in regular bi-weekly meetings with service providers, as well as regular meetings with SSMs across Ontario to foster connections, share best practices, and collaborate on challenges. In addition, collaboration with social assistance has been a key focus for an effective integrated employment system model. To share some early data, this graph represents the period of April 1st to June 30th, 2024, which is the first quarter in the ministry's fiscal. During this time, the SSM achieved 100% of client intake volume, as indicated on the slide. We are also exceeding our commitments to serving clients from the inclusion groups mentioned earlier. The SSM continues to monitor data and evaluate performance of the service providers and the network as a whole. Throughout the first quarter, 579 clients received employment services and achieved an outcome of employment of 20 hours or more a week. 35 clients completed long-term skills training or education, and 95% of clients were satisfied at the completion of their employment services. Also worth highlighting, between January to June 2024, a total of 3,800 social assistance clients were referred to employment services. These numbers demonstrate the promise of an effective integrated employment service system. As the SSM, we are beginning to become actively engaged with both the community employer sector. You will find on this list events we have participated in or presented at, and these events will be essential for our continued success in the delivery model. Another important update to share is regarding the integration of social assistance clients into Employment Ontario. This includes several key elements worth highlighting. The first being the common assessment tool developed by the ministry. This is central to the integrated model and consists of 2 modules. It is a digital questionnaire used by social assistance and employment service staff and entails the assessment of clients' strengths, barriers to employment, and support needs to facilitate appropriate service planning and referrals. Collaboration and coordination among all delivery partners is crucial under the integrated employment service model, ensuring shared accountability for achieving positive employment outcomes for social assistance clients. In order to facilitate coordination, the SSM created referral and benefit guidelines in collaboration with ODSP, OW, and the employment services providers. The SSM has also fostered communication, collaboration, and engagement through an ongoing meetings, case conferencing, and information gathering to further advance the integration efforts. We've identified some key priorities and subsequent actions that will be essential for our success as the SSM. The SSM has been collaborating with Bawajigewin Aboriginal Community Circle and is prioritizing the hiring of the Indigenous support worker. Stakeholder engagement is a key priority, as working with community organizations and employers within Durham Region is central to the SSM's program mission, vision, and values. Strengthening the relationship between social assistance and employment services and fostering greater collaboration is vital for streamlined referral process and integrated client supports. Ongoing training and development continues to increase and strengthen the capacity of the network. And lastly, the SSM plans to extend marketing efforts and increase exposure of local employment services using various promotional strategies. I'd like to thank you again for the opportunity to present to you today, and I'd be happy to answer any questions that you may have.
Christine, thank you very much for the presentation. I do have Mayor Foster, but this presentation is directly related to the report, which is 8.2. So I'm going to ask that Mayor Foster, as being the first speaker, would you move it to motion to receive and then and have a seconder, Councillor Anderson. And Mayor Foster, you have questions on the report and the presentation.
I do. Madam Chair, thank you. A great plan to deal with both at the same time. So a couple of quick questions. The same question that I asked of the last, the slide 26, while you've got some data, I'm trying to pick my word carefully. I'm going to use the word success, knowing that it's a really bad word. In terms of this, that it's more broad. 579 clients out of 3,801 had an outcome of employment. So do you have deeper statistics in terms of how many people are going through that leads to the outcome that we're looking for?
Absolutely, we have lots of data.
Perfect.
It's a tricky time right now because it's so early since launch. So the referrals, it takes time from the time that a client is referred to a client meeting with the employment service provider, completing the assessment, the second module of the common assessment as well. So it's still early. I'd be happy to put forward some more data.
I'm good. I assumed that you were doing that, so thank you. On the other, you were looking at the groups using the services versus what you thought. I assume, and again, I know these are early days, I assume that that your experience with the groups using the services will determine the priorities and services. So you are looking at the appropriate audience?
Yes, we are. So of course, we have set key performance indicators that the ministry puts into place, but also looking at the gaps in the community and the demographics of the clients. If we identify anything where there is a lack of service, that's where we look to the specialized funds, where the service providers can submit expression of interest to for more funding to increase and enhance their services to that particular demographic. So.
And I suspect you're going to give me the exact same answer. I'm making the assumption that through collaboration, we are capturing some of the people that we are seeing on our outreach programs. So, so the unsheltered in particular, you know, that outside of a library won't have access to, you know, the digital resources. So can you speak to how we're dealing with the unsheltered?
So our service providers are very well connected within the community to support the unsheltered. We do have at all the locations that you would have seen on the map there are it is a resource center available for clients to access computers, internet, what have you. But also our service providers are mobile in the community as well. So not only do they go to those sites specifically that were highlighted with regards to the itinerant sites, but they also will meet a client in the community on an as-need basis.
That's good. One of the reasons I
Mayor
asked that.
Foster, Lisa McIntosh, Director, also has some
great.
input as well too. She's here on behalf of Stella. Stella's online joining us, but Lisa has further comment.
Just wait in anticipation as that red light shows up.
Yeah, there you go.
So for the unsheltered population, the way the employment system work is laid out for us, we have KPIs in 3 streams of clients. So the employment service system is for anyone seeking employment in the region of Durham. And so the way clients are streamed is the level of intensive support they require. So the unsheltered community that you're talking about, that staff would be out and navigating, they would fall under a stream C client in the system. And so each area of the system is managed different. And so when Christine's talking about the funding that went out to specialized populations, there was specialized funding for youth services, a partnership where services, and Christine will correct me if I'm off on this one, but on working with Scugog Island and other Indigenous partners and an EO, there was service delivery offered so that those people seeking employment in the community would be able to access services where best for them. So we are working on options for the unsheltered, and we do have some strong partners who actually serve both systems and work within both systems, such as John Howard that has employment services, and then very strong services for the population of people who are also addressing and trying to move forward in their need for shelter.
Perfect. Thank you, Madam Chair. Thank you. Thank you.
Thank you.
Thank you. I have Councillor Anderson.
Mayor Foster has asked most of the questions I wanted to ask. However, I will ask, what would you consider a good outcome from this?
So our key performance indicators would consider a positive outcome as a client becoming employed at 20 hours or more per week. And we actually are required to do checkpoints with that client, milestone checkpoints at the 1 month, 3, 6, and 12 months, where service providers, when connecting with the client, ensuring the client's still employed or re-engaging with them, that's where they have the opportunity to earn the performance-based funds to increase their capacity. So we do have stats. I'd be happy to share them with you with regards
Thank
to
you.
that. And it has been a challenge, and some feedback that we've heard from other catchment regions that were ahead of us is that 20 hours or more it can be a challenge for some clients, especially those that are on ODSP or with disabilities. So there are clients that may have received the support, are employed, but it actually doesn't even equate to our outcome factors because of that 20-hour benchmark. So
Well-
it's so new still. We're still learning and figuring out all the data that we have available to us.
One final
Please
question.
go ahead.
How do you reach the clients, especially the unhoused? How are they becoming aware of that this service exists, or they can access this type
Yeah.
of service?
So the service providers conduct their own outreach within the community and have partners with shelters. Lisa also mentioned we have John Howard Society as our service provider, who also does a lot of work and programming in the unhoused. So that typically is our way to reach clients. We also have service providers going into the motels to support the refugees as well. They're just through outreach and being in the community.
Okay, thank you.
Thank you. Further questions from online? So I don't have a question for you, but I have actually a question to the CAO and to the chair. I think this would be a beneficial presentation to be brought to a committee of the whole for all of council to hear. I think it's a great program and the success of it as well too. So we have a motion on the agenda already to receive, so we'll deal with that, and then do we just refer this to?
Yeah, just that the presentation be brought forward to committee.
Okay, so we'll deal with the report, and then we'll have a motion to move the presentation. Any opposed to receive for information on the report? Seeing none. And to the regional chair, we have a motion to refer the presentation to committee of the whole.
Yes, absolutely.
Seconder, please. Mayor Foster. Any opposed? Thank you, Christine. You're coming back for another.
Thank you. I'll be sure to have more statistics for you.
And we're moving on to delegations. Colin Barnard, a Scugog resident, is supposed to be here in person. We do not have him online, nor is he present in the audience here. What we can do is hold this if he happens to attend by the end of the meeting, but I think we're going to move relatively quickly through the rest of the meeting. Correspondence from City of Pickering. This was pulled by Regional Councillor John Neal. I'm going to need a mover on receive for information. Councillor Anderson, seconded. Chair Henry, is there any questions from committee members? And I'm going to turn to Councillor Neal.
Yeah, good morning, Mayor Roy. I would ask that it be received for information, but also that we endorse it and that a copy be sent to a Durham Agriculture Advisory Committee. That Durham Region stands behind the free water testing for residents and farms, et cetera, that in the rural communities that are still on wells. It's important that we maintain that And I heard quite an outcry when it was decided that for some reason that we were going to change that free water testing. So that's what I'd be asking besides the receipt for information. If someone could make that the endorsement and send a copy to the Durham Agriculture Advisory Committee, I'd appreciate it. Thank you.
Thank you, Councillor Neal. So I'm going to move to committee members. I think essentially, is this friendly to CC this to the Agricultural Committee? Yeah. So we're taking it as a friendly, Councillor Neal, and a copy of this will be sent forward as well, too. Thank you.
Thank you very much. What about endorsement?
Do we want a motion for endorsement?
Pickering did.
Councillor Anderson? You'll move endorsement? So it's adding in addition to, so it's an amendment to receive for information. You're adding an amendment for endorsement. The Regional Council endorses the recommendation. Have a seconder? Mayor Foster? Further questions? Mayor Foster?
Thank you. Dr. Kyle, and I'm looking at you, I don't know what particular input you can put into this. Asking the province to bring something back, I don't see any particular challenge with endorsing this. I think our experience with the provinces are going to do what they're going to do, but can you provide?
Two pieces of information we sent to Councillor Neal. The first is the Minister of Health wrote to the President of AMO to indicate the province has no intentions of withdrawing free private well testing. And when I followed up with my contact at the Ministry of Health, they basically echoed the minister's position that was communicated to the president of AMO. So if you're asking me, is there any foul or harm done by endorsing this? No. If you're asking me, is it necessary? Probably no.
Thank you, Doc. We're carrying on a theme from the private conversation earlier. So, I guess, is there foul or harm? I do have some concerns where we do the motions, we make the request when we already know what the answer is. And I guess politically on one side, I see the value in saying, would you please, even when they say no, but I also see the downside where so many requests come from municipalities, upper and lower tier. I sometimes wonder if the things that we might impact get lost amongst the rest of them. Councillor Anderson, I see you want to chat, so I'm going to shut up.
So Councillor Anderson.
Yeah, the reason why I endorse this, I've had a couple of concerns about the province withdrawing the testing, so I am glad that Dr. Kyle has clarified that. But it's out there that it's being withdrawn, so maybe this will help to, I don't know. So that's it.
Further. Chair Henry.
Through you, Chair Dr. Kyle, so it's not being withdrawn. So wouldn't it make sense that we do some form of information or education process to make sure that people understand the process is not changing? If it's not, and the word is out there, maybe we need to correct what's happening.
I would think that communications would be helpful in terms of who owns the communications, whether it's us to our local community versus the province to the people of Ontario. I would think the latter would be preferable, but if you're asking, is there a way for us to communicate our understanding of this issue to Durham residents, I'm sure we can take that back and work on some sort of communication strategy.
So, Madam Chair, if you would accept that as direction.
So we'll take that, I think we can take that as direction. If I could have the mover and seconder to, if they would take away the amendment, and then we'll just move with, that's fine. Thank you, Councillor Anderson, for, and as the seconder, Mayor Foster.
Yeah, I'm fine. That's actually, I think, a far better way of dealing with it.
Okay.
Yeah, Chair Henry, thank you for that.
Okay. Councillor Dyes, did you have your hand up? Okay, thank you. So as we stand right now, the motion is to receive, but with the direction that communication plan will be looked at through Dr. Kyle's office. Correct? Thank you. All in favor? Thank you very much. Moving on to 8.2, and then we're going to go to B, which is the report for the unbudgeted provincial funding for the Ministry of Education for the Canada-wide Early Learning and Childcare System. Mayor Foster, are you moving it?
Sure, I've got a question as well.
Okay, seconder, please. Councillor Anderson, Mayor Foster.
And this is a broader question. On a regular basis, we see unbudgeted provincial funding, which I'm gathering means there's a pleasant surprise. If I'm reading the report correctly, a lot of the money is simply going to pay staff that have already been put in place, that if we didn't get the money, something unfortunate was going to happen. While we complain to the province on a regular basis, do we thank them for this? And the reason I pointed out that most of the money is going to staff that we already had to hire because of putting programs in place, I'm not sure they're doing us a favor all the time. So sticks and carrots. Do we ever say thank you and recognize when additional funds come our way? And is this yet another example of having to manage by lottery wins? You put programs in place that are needed, only to hope that unanticipated funding comes to continue the programs that we need. Madam CAO, I'm sort of looking at you, so.
Thank you, through you, Madam Chair. Yes, absolutely, we do send thank you letters to the province regularly when we receive funding, and also congratulatory letters if a new minister is appointed, for example. With respect to this, I think I'll turn it over to Lisa, but you are quite right. The financial pressures in the childcare system are considerable, especially the staff ones, which is driven by staff-to-child ratios. So we have limited flexibility there, but I will let Lisa comment on the rest of your question.
Lisa?
Thank you, and I'm going to turn it over to Director of Children's Services, Julie Gaskin, for a detailed response.
Thank you. Yes, through the chair, thank you for asking that question. In this particular circumstance, this is additional funding that we requested because we were predicting a shortfall in the existing funding that we were getting out to childcare. It's part of the Canada-wide early learning and childcare system, and that whole system is in a transitional phase. We're phasing out of one type of funding into a different type of funding. So this is kind of year-end. I won't call it a cleanup, but it's a little bit similar to that. We do certainly struggle with one-time funding allocations because you can't do a lot with those. You can only do certain things. And we definitely do thank the province whenever we do get those additional funding pieces. But this one specifically certainly took me by surprise. I was actually standing in the airport when I got the memo and went, that's nice. They gave us what we asked for, which was really good. And we were looking at asking for funding in a different way. So I will have additional information through a CIP coming out that's going to give some detail and certainly would be able to provide a bit of a presentation to this committee on some more details. It's fairly complex, and the new funding formula is making it a little bit more complex, and there's a lot of confusion about it. So I'd love the opportunity to come and speak more about it. Thank you.
Mayor Foster.
Yep. So thank you for that, Madam Chair. Thank you. I wonder if it behooves us, the elected representatives, as much as we have many complaints and many asks, perhaps we should recognize you know, the good as well as the bad. So thank you for that.
Thank you, Mayor Foster. Is there further questions? And any opposed? Seeing none, hearing none. We have nothing for the advisory committee resolutions, no confidential matters. Is there any other business? Mayor Foster.
Okay, I'm the guy dragging the meeting on here. I apologize.
No, it's all
for
good.
that.
It's all no,
So
great
it's-
information.
So a question, and I fear I know the answer, and I'm hoping not. Lisa, you're going to be the one probably on the hook for this. Read with great enthusiasm that Premier Ford has indicated that the unsheltered, this was in the Toronto Star this morning, an announcement with Mayor Chow, that you know, they would be dealing with the unsheltered, working with all levels of government. I have two fears. One is that the province is perhaps moving forward without engaging us. We see that frequently, and the fear that arises out of that is a lack of understanding that if we have transitional housing put in place, we absolutely need the supports in place. You know, they can't build, or we can't build a bunch of transitional housing without those supports in place. And the other piece, that whatever they do, there has to be a rollout that is equal across communities, such that no one community becomes the destination for the folks that need the services, creating a different problem. Prior to the announcement, was there any suggestion on outreach? You know, are we working with them? Do we have any insight in terms of what the province may or may not be proposing?
I'll take that on. Thank you very much. The regional and single-tier CIOs meet with the province regularly, as recently as last Friday. There has been no outreach specific to what you've raised. And in fact, I think as the committee knows, we have literally been to both levels of government, every department you can possibly imagine that would have any responsibility for housing, affordable housing and supportive housing. And at present, there is not a program available in Ontario through the province of Ontario. The Deputy Minister has all our data, our funding requirements, our housing proposals, and is, from what I understand, working towards creating a program. But at this point, there is nothing available at the province. So I'm not quite sure what the Premier is referring to. We'd dearly love to get support prior to the winter season for 1635 and other shelters, but right now it's not available.
Yeah, so Mr. Chair, and you don't mean to, you know, load this on you, but I wonder if something comes from, you know, some communications, be it from this committee, from the chair's office. I think we're having the same discussion that we did a moment ago, perhaps on the water testing, but how brutally important it is the province understands that, you know, without distribution across a number of municipalities and without those services, they have the potential to create a complete and utter disaster in neighborhoods. So trying to fix something could create a far greater problem, and perhaps you know, the councillors and mayors can take it upon themselves as they're speaking with their MPPs to try to get that message across.
I think one of the things just with the answer is also getting the clarity, and just in light of like just the AMO with the housing conference that just took place this past week, it is one that the campaign for Ontario Big City Mayors, which you're a part of as well too, we need to see the proof in the pudding, right? Like we really need to understand what that really looks like. Our migration of our homeless right now is taking place, and we're seeing more of a presence even in the summertime where we still saw, but now we're seeing really more of our homeless being present in different areas without shelter over them. I think it's telling that clear story. It's great to make a comment like what was stated this morning with the Mayor of Toronto, but it comes back to the clarity of like, what is this announcement going to be for us? And I sometimes feel, and this is my personal opinion, I don't know if others share it, I feel that sometimes when the discussion about, especially around homelessness and the need for housing for the eastern section of the GTA is forgotten, and it's not one that is being recognized. I will share that tomorrow, I do have the Mayor of Barrie coming for a visit, just because he's been like, I've been vocal enough and he's reached out. I want to hear about what you're talking about. So he is coming out with our outreach team as well too in the morning, and meeting with staff and sharing now of our story, because I think we have a really good story. And by the way, it's 1 year that 1635 has been brought to fruition. And it is like, there's great successes. To know that even we have a gentleman who celebrated his 85th birthday in our shelter is one that we need to be celebrating. We celebrate our residents who have their memorable birthdays. It is also one that we need to celebrate those who are on our street. But it is, I'm gonna tell you, this is really frustrating for me, and the effort that is being put out there with our staff. And I see what our staff, even as of last Friday, meeting with a business person who originally, when he speaks to me, is fine, but when he speaks to staff is not fine, which is not acceptable. But when our MPPs, who have not even visited the facility, some have, don't get me wrong, some have, but it's still an attempt to understand that homelessness within our whole community is there. Durham does have it all over. It's my soapbox. I'm really sorry, but it's like, it's just really, it's frustrating to no end. To know that, like, I got a phone call yesterday about a couple living and moving through our parks, moving through our shopping malls, and for 2 years has been residing in their motorhome. And it's just, it's not acceptable. Sorry. Lisa, go ahead.
Through the chair, and thank you for pointing out staff's efforts, because staff are working diligently and many times alongside provincial staff. So we are hosting visits and tours to ministers and the ministers' teams at the provincial level, and we are, any funding opportunities that have been rolling out, and there are quite a few of applications recently, we are working in collaboration across corporate communications, the social services team, and community partners to put in applications on initiatives such as the Heart Hubs that were announced recently, and any other efforts. So we are definitely having those backroom discussions and tours, and actively engaging and having Durham's reality shared broadly across our partners, both other local municipal areas, but then also provincial and federal representatives whenever we can get them out.
Great. So it's good to hear on a staff-to-staff basis. I think we all share the concern that announcement will come, ignoring some of the fundamental things that the provincial staff that are dealing with the problem, that the federal staff, however removed they are, that was a less than subtle shot, which was perhaps unkind from the issue. But I think the decision makers, have to understand that if they can solve a problem or create a greater one. And Chair Roy, I think somewhere in Queen's Park there's a map. Highway 48 is on that map. And on the other side, it says there'd be monsters here on the east side. It's an old Mariners map somewhere there. But thank you ever so much.
Kind of agree with you. I'm going to turn back to, Chair Henry.
So, Madam Chair, thank you to Mayor Foster and to you, Chair, and to members of the committee. I have authority through pass a resolution to council. So I will have staff help me with the wording of the letter, because it's much better when staff help me than when I write a letter to the Premier or the Prime Minister. The efforts of our team here at the region to invite all of our MPs and MPPs has been simply amazing, and we've had a chance to meet with a number at both levels, but not all, which is a shame. And when you mentioned today that the Mayor of Barrie is coming down to Durham to see how and what we're doing and why we're successful, because we have a story that we need to tell here in Durham region, and what we've been able to do is something that a lot of the communities across this country are trying to emulate or copy in some way. The sad news is that you mentioned the Mayor of Barrie is coming here to see what we're doing, because there is no plan in this country to manage homelessness, mental health, and addictions. And during our budget process that's coming up, the costs related to mental health, homeless, and addictions is seen in our police budget, it's seen in our health and social services budget, it's seen in our works budget, it's actually seen in probably every part of our budget. And I'm going to be honest with you, and I have said this publicly, so I'm not going to get anybody here in trouble, because this is my opinion, that if the governments don't combine and look at this problem, they're going to bankrupt communities across this country. Now, Durham Region is fiscally responsible as a region, and we manage our monies well. But the percentage of this year's budget that will go to housing and homelessness and addictions and mental health, which we're not supposed to pay for with property taxes. This isn't what property taxes were designed to do, is a challenge. And, it's terrible that it takes I'm just going to be honest, it takes an election at the federal level of government to get anybody's attention to talk about these issues. And then the election's over and we're still talking about issues. This is a national crisis across this country, one of a magnitude that we haven't really ever seen before. And yet, during really difficult times, this country has done some really big, bold things. So we're able to manage and do great things. But without the support of the other two levels of government, you cannot expect taxpayers, property taxpayers, to pay for this. And it's may I continue on this little bit of a rant?
Have my soapbox.
So it's not just the challenge of mental health, homelessness, and addictions. It's the challenge of asylum seekers. And I'm grateful that they choose to come to Canada to live that dream and in a country that is simply amazing. But without the supports of the federal government, it just increases the number of people that we have to put in place to manage this. And in the end, making someone whole is not shortchanging us on the money that you give back to us, because we still have to make up the difference. We do so many amazing things each and every day, but there is an anger out there. And the anger is often focused at the mayors and some councillors, me as the chair, our staff, our municipal staffs, on something that we can't fix. And, I'm hopeful that as nominations close in every riding in this province or across this country, that the mayors in the communities where there's candidates make sure all of the candidates, we almost need to prepare a handbook to give each of the candidates to say what we actually do, so they understand what we do, because some of them won't meet with us. And that's a shame. So I'm happy to write the letter, Mayor Foster. I'll look back here and see if I can get a nod. I got a nod that it'll be much kinder than the letter that I would write. And we'll get it out today or tomorrow.
Thank you very much, Chair Henry. Councillor Dice.
Well, thank you, and thank you to staff in the room who work so very, very hard on this issue. And it's increasing, as you know, as we speak, and yet nothing's being done about it, and it is very frustrating. So we have encouraged the private development sector to develop, yet nothing is happening, because clearly, financially, the economy isn't supporting development at this time. It's too costly. So I guess my question to the government would also be, so where is, I guess we can't call it transitional housing if if we needed to transition to that transitional housing. So we need maybe those cabins, and I keep talking about this. We need an encampment, which is not a great word, but a community space where they actually have a heated cabin and somewhere to put their belongings with a locked door so they can have some sort of life while they wait for transitional housing. And I think that's something we're going to have to figure out because it's not going to happen by the upper levels of government. And I don't know how we do it. But I really think that there's a huge need because again, another winter's here and we have nowhere to put people, yet the numbers have increased. And what are we going to do? I mean, it was a godsend having the Whitby site, but it's still not enough. So I think that we really need to get the message out to the province and to the federal government that we need an interim, fix to this problem. It could be temporary, it could be something you can, they're reutilizing housing in other areas where they're developing. Maybe we can get some of that, but we can reuse something and that can be reused somewhere else possibly later down the road. So I don't know. It's, I think that has to be discussed with, those upper level of governments as well. It's just, so if you think of anything, let me know, please.
Any further questions or comments? Hearing none, seeing none. Any further other business? I am going to one more time go back to our delegation. I have not seen anybody enter, but I'm still going to call upon. Is there a Colin Bernard online or present? Hearing none. I'm going to move to the next date, which is November 7th for our next meeting. Motion to adjourn. Councillor Anderson, Mayor Foster, any opposed? Thank you very much. Have a great day.